I'm Julie Panapino, and I'm a professor of pediatric hematology from the Medical College of Wisconsin, Children's of Wisconsin in Milwaukee. Welcome to this fourth press briefing of the 61st ASH Annual Meeting and Exposition, Transforming Care for People with Sickle Cell Disease Across the Globe. As we begin, I want to remind everyone to please silence your phones and turn off the shutter sound on your cameras if you are able to. The three studies presented this morning highlight efforts to offer better treatments and more comprehensive care for people living with sickle cell disease across the globe. Individuals with sickle cell disease produce abnormal hemoglobin, a protein in red blood cells that attaches to oxygen in the lungs and carries it to all parts of the body. Red blood cells that contain normal hemoglobin are donut-shaped and flexible so that they can travel smoothly through the smallest blood vessels. In sickle cell disease, however, the red blood cells are sickle-shaped and rigid and contribute to damage to the large and small vessels of the body. This vessel wall damage leads to activation of other blood cells, white blood cells, platelets, and recruitment of inflammatory mediators that, together with the sickled red cells, contribute to the complications of sickle cell disease, such as intense, frequent pain and other serious issues such as stroke, infection, pulmonary complications, and even death. We're at a pivotal point in the treatment of sickle cell disease. Within the last month, the FDA approved 2 new therapies for patients with sickle cell disease. And we may have gene therapies on the horizon that could really help patients living with this disease. But we'll need to continue supporting sickle cell disease research and access to care. These are crucial priorities for ASH, which in 2016 launched a multifaceted initiative to address the burden of this disease, both in the United States and globally. This important initiative is marked by a few key developments over the past year, including the establishment of the Sickle Cell Disease Research Clinical Trials Network and Data Hub through the nonprofit ASH Research Collaborative, as well as the launch of ASH's first ever clinical practice guidelines on sickle cell disease. The first chapter of the ASH clinical practice guidelines on sickle cell disease, focusing on cardiopulmonary and kidney disease, was published in Blood Advances yesterday, with additional chapters anticipated in 2020. More information on the guidelines is available at the website at hematology.org. Additionally, on Friday, ASH and the FDA released a comprehensive set of recommendations aimed at establishing uniformity and global standards for clinical trial endpoints used to evaluate new therapies for sickle cell disease. These recommendations are also available online in Blood Advances. Though there are very few treatment modalities and even fewer curative options for sickle cell disease, ASH is committed to accelerating the development of new therapies for this community. Taken together, today's results illustrate how the progress is being made all the way from the laboratory bench to dissemination and implementation of better treatments and systems-level quality improvements. Researchers are moving the needle with studies both here in the US and around the world. Dr. Jeffrey Shearstone of Syros Pharmaceuticals will present the results of a study that suggests a protein known as nuclear factor 1X could offer an opportunity to correct the red blood cell abnormalities that are at the heart of sickle cell disease. The research confirms NF1X's role in helping precursor red blood cells switch from fetal hemoglobin expression to adult hemoglobin expression and suggests the protein could one day be targeted by a drug for sickle cell disease to restore fetal hemoglobin expression, allowing the body to make healthy red blood cells instead of sickle-shaped ones. Additional details are available in abstract number 812. Dr. Richard Onalo of the University of Abuja, Nigeria, will discuss a new study supporting evidence that arginine, an inexpensive over-the-counter supplement, enhances the effectiveness of other pain medications and could help improve sickle cell disease management in Nigeria and other African countries with limited resources and a high prevalence of sickle cell disease. In the clinical trial conducted in Nigeria, Dr. Onalo and team found that children who were given oral arginine supplements during vaso-occlusive crisis as a result of sickle cell disease reported lower levels of pain, required less pain medication, and were discharged from the hospital earlier than those given a placebo on average. You'll hear more from Dr. Onello shortly. Additional details are available in the abstract number 613. Finally, Dr. Anjali Mahajan of the University of California will share the results of a new study suggesting that fragmentation in care among people with sickle cell disease increases dramatically with age. Consistent, coordinated medical care can help improve complications or prevent complications from complex conditions such as sickle cell disease. However, the team's analysis of nearly 7,000 health records of sickle cell disease patients revealed a stark shift in which patients went from receiving care at 1 or 2 facilities in childhood to over half of patients receiving care at 3 or more facilities after age 18. The pattern continued well into adulthood. Additional information can be found in abstract number 4667. To ensure that we have plenty of time for all of the presentations, we ask you to please hold your questions until the end